I think surviving teenage years in itself is really, really tricky. And certainly I've come from Birmingham today, and there we've moved our mental health services from 0 to 25 as opposed to 0 to 17 for that exact reason, for supporting adolescents as they go into adulthood. And I certainly think that is a trend that should be followed across the country. I think nowadays we have huge expectations on that age group. As Leroy said, yes, and Jim said about the children and the care leavers leaving and going into this world and not having the support that's been in place. And the reality is that we've not addressed our coping strategies, if we've not been able to get help for the trauma perhaps that's been in childhood as we develop into adults, unless we have the stability there of good jobs, of good relationships, then we can't expect the outcomes to be any different. And what we are seeing that we are developing into a society where people are getting jobs, but as mentioned earlier, are 0-hour contracts. We're seeing people who are not able to attend appointments to do with their mental health, because if they take time off, their employer is then cutting their hours the next again week. And really that's, I suppose, where we really need the funding within the NHS to be able to increase the hours that the mental health workers are working, to make it a more accessible service, to cut these waiting lists down. We've done a fantastic job in the UK of addressing mental health stigma and encouraging people to talk about mental health, which obviously has led to more people coming for help. But unless we increase the number of people that are available to help, then they will sit in the waiting list. And that is very as a mental health professional, it's hard knowing there's people waiting for help.
Absolutely.